Thank you very much. Welcome everyone, and I just wanted to thank you all for being here today, and a heartfelt thanks to all the healthcare professionals within the province and to your staff for all the work you've done over the past 2+ years. It's not been an easy time. Trust me. I'm sure we all know that. I just wanted to touch base. Who's in charge? I know we're in a healthcare crisis, and I know we need physicians, we need nurses, we need nurse practitioners, and it was brought to my attention just recently, we need dentists too, because our dentists are getting older. We had a young man come to my riding in the St. Stephen area to take over a dental practice, and another dentist heard he was in town and decided he was retiring too, so here you go, young fella, fill in for two of us. So how are we making out, who's leading the charge in recruitment? Is it Horizon, is it the health department? And are we spending more money, additional funding in getting that job done than we did perhaps in years past?
So there's been a renewed effort on health human resource recruitment. I do want to specify there's always been a lot of effort there.
Yes.
But what it was, if I can use the term disjointed, is we had multiple moving parts that were not necessarily aligned in the approach. Mm-hmm. So what we've done over the last 6 months is we're increasing the size of the health human resource recruitment unit within the Department of Health to ensure coordination. So, and it's not just the Department of Health, social development in terms of long-term care is involved, as well as PEDAL in terms of all the accreditation processes, etc. So the three deputy ministers, myself, the deputy of social development, the deputy of PEDAL, meet on a weekly basis with our executive director of health human resources to really push and monitor the approach going forward. We have a collaboration built with the RHAs in the long-term care sector. So the objective provincially from the department standpoint is really the promotion of New Brunswick as a whole and the promotion of our major employers as great employers. And then for when you raise St. Stephen, the best person to sell St. Stephen is someone from St. Stephen. Mm-hmm. So what we want to do is identify who's interested in coming to New Brunswick, who's interested in rural areas, what's the specialty you're interested in, and then once we have them interested into New Brunswick, it's someone from that community, whether it's the municipal government or the RHA, that is really selling the position itself. Mm-hmm. So it's a more coordinated approach. It's always a work in progress, but we're seeing some positive results over the last few months in terms of that coordination. It's a better approach. I will not say that we are where we need to be yet. It's still a work in progress, but the improvements are drastic.
Well, I know personally that we established a physician recruitment committee locally because we felt by involving community members that was the best way to recruit physicians. So we are working with the RHA and we have worked with your department, and we've been successful in recruiting at least one and possibly 2 or 3 more. But we do need, I think, and this is just my own comment, we do need to change the way we recruit or the parameters under which we recruit. If we have somebody interested in coming to a rural area who wants to just work within the rural area, perhaps go to the islands once a day or to fill in for another physician so they can get some time off in the evenings or the weekends, we shouldn't hold them, in my opinion, we should not hold them to a requirement that they have to work in the hospital if they don't want to. Because to be honest, we had a situation where that happened and we didn't get that doctor. So, and there are other physicians who want to just work in the hospital, who want to be hospitalists. So are we going to the medical schools and finding out what these potential doctors, these future doctors want and where they want to be? Like, do they want to be in an urban setting? Do they want to be rural? Do they want to work in hospitals? Do they want to have a family practice? Are we doing that?
I would say that's one of the areas we need to do drastic improvement on, is being more aggressive, particularly in our medical schools and our nursing schools, to ensure that everyone knows that there is a job for them in New Brunswick. I know the situation you're speaking of the physician that you were hoping to get to Charlotte County and that ended up going elsewhere. That level of flexibility, that when it gets down to that level, is definitely the RHA. But we've been discussing with the RHA, how do we build more flexibility for those physicians to make sure we get them?
Yeah.
The best I can say is that is a work in progress.
Yeah, and I know you know, but most of the physicians that we have spoken with want to work in a clinical setting. They want to work with at least 2 or 3 other physicians. They're not like the old-time physicians who would have a practice of 3,000 or 4,000 patients. So, but we are working towards that. What about for nurses and nurse practitioners? I know we've had a lot of good announcements lately in the bridging program and things like that. Is there anything else that you can perhaps share that's on the horizon?
I think Minister Fitch will have some positive news to share in the coming months around collaborative practice, as you talk about, because not only physicians want to work collaboratively with colleagues to be able to share the patient load and really ensure a more complete care to patients, but so do other professionals, the nurses, the nurse practitioners, the allied health professionals. So I would expect that Minister Fitch will have a few announcements here in the coming months once the budget is approved.
All right, and was there any money in the budget years that we were speaking of to set up clinics, and will there be any money or to set up collaborative care, I guess clinics, physical buildings, and will there be any money in the future?
Quick answer is yes, there was money in the past. It was through a partnership with the Medical Society, Family Medicine New Brunswick.
Okay.
But we do hope that the budget process will be kind and allow us to invest more in that area.
Okay, because that is a drawback, especially to a community group trying to find out or find an area that they can set up as a collaborative practice for 2 or 3 doctors. It's all about money. And small communities don't have a lot, but we still need the doctors and the nurses and the practitioners and the dentists. So don't forget the dentist, please.
Yeah. Very good points, Ms. Bockus. The other aspect that we're very cognizant of is individuals that go to med school don't go to med school to be business operators.
No.
So how do we support their businesses in terms of the operations, the HR functions, and all the other administration required? So.
Well, thank you for your work and keep up the good work. I'll look forward to hearing or seeing some results. Thank you.
Thank you.
Thank